everybody for inviting me here. It's a pleasure. I feel like being among friends, and I wanna present to you an interesting interesting case that I have managed through the years. And the first thing that I want to bring to your attention is what do these two patients have in common? I'm sure that Sabrina and Shubra both will recognize the complication, what will bit about, but because if you can answer to this question, you will know what's going on with the patient that about to present. So let's get into the patient concerns. Is a 60-year old female, occasional drinker, not a smoker. She's been referred to me from Argentina with a history of progressive ptosis and swelling during the last 4 years. So she has had facelifting in 2015 in New York. She travels the world. She is a very prominent person in Italy, but she lives in South America. So she has consulted with everybody before seeing me all across the world. And a few doctors suggested could have happened after the facelifting because of blockage of lymphatic. She had a history of injection with silicone, and she had also other treatment with fillers, Botox. She had it all, but she doesn't tell exactly what was it. Other interesting stuff is there are three things here in her past medical history that ends with itis, so vasculitis, colitis, sinusitis. Has this anything to do with the immune system? You can see this is the patient as I saw her in my office in Milan. She comes in with a ptosis, significant ptosis, with a 0.5 or 1 MRD1 or on the right, 1.5, maybe 2 on the left. She has symmetrical high crease, no brow overaction, a good function, not extraordinary good, but better than 10. She has some upper lip scars indicating a bluff. She didn't mention it specifically. And she has this pretarsal edema. This picture without flash, you see it better. She has really heavy lids on both sides and ptosis. And then she uses them well, but she feels really blocked, the visual field and such. So she doesn't have a funny appearance to this area. So it's really hard to know what happened. But she's been free of treatments for the last year. So she has not had anything injected into her face for the last year. But nonetheless, if you look at this patient and the history of injection, you notice that she has something funny to their in this region. So you would notice that the glabella is funny looking as well, as much as the lid. So it's larger than normal. There are no glabellar lines. And if you look at from the side, she's lacking concavity, the physiological concavity. She looks like an avatar or something of the sort, and edema of the upper lid resembles this one of another patient in the lower lid. So it's a bluish edema. So what is this? Can it be what I think it was? So delayed edema, HA related. It surely this to bring out how the glabella is kind of deformed and in that part. So yes, that is what it is about. Few scatter isolated case reports across the literature we brought together with my friend Maurice Arstein and his team from Israel. We combine our series and we publish it just recently on the Aesthetic Surgery Journal. Late onset upper edema and brow edema is a long-term complication of hyaluronic acid filler, and it's really so that as simple as that. Once you see it, you can treat it, but you figure out that all the surgeons she has consulted, even the best, even the oculoplasty surgeon, suggested she had surgery. So this few injection that I gave her of hyaluronidase right straight in the eyelid. This is not specifically that patient. This is a different patient, but the technique is just the same. The amount may vary, the position may vary. In this specific patient, the edema is above the the eyelid crease, and that patient was specifically below the eyelid crease. So it will change the location, but nonetheless, the treatment will be the same. So you will see the patient, how she came to my office, and the next day, this is 24 hours leaving my office, sending these pictures to her referring doctor and say, oh, that was a great thing that you did to me. And that's when she came back. I don't know why it's running so fast, this one last picture, but remember, reminds also of this patient with ptosis, pretarsal edema. And again, if you look at the glabella and you see here some kind of looking like the spillage of the hyaluronic acid coming from there across that area, and you treat the patient and the patient go well. Different location because of different potential areas of treatment come from this lateral brow edema, maybe because of the excessive temporal and brow injection, and this again responds very well to that. Again, upper sulcus too swollen there again from brow injection in this patient, and the treatment still is hyaluronidase, bringing it back to normal. So now you know what these two patients have in common. And again, we publish also on the lower lid complication always in the Static Surgery Journal. So 1 year apart, two different publications on HA related to the lids, so specific that cause a dysmorphic changes. So something that is so striking, peculiar that you can diagnose it without any further studies. Pathognomonic. So this is the patient in the lower lid 3 years after, and this is after. So this is, I think, is important for us as ophthalmologists. Don't recognize this. Nobody else would. So we really need to know that in the time of hyaluronic acid injections, any sort of edema in the lower lid, the first thing we need to focus on is the hyaluronic acid injection, even if the injection was done years before that, because my last up to 10 years, we have the longest occurring such of a condition. So I invite you to get in touch with me in any way you want to, for the papers, abstracts discussing this. So with this, I'll give it back to you. Thank you for